I'd like to welcome everybody from the OAO to our first ever member spotlight. My idea with these online interviews is to highlight some of the interesting, cool things that members from across the province are doing in their practices and their community. And today we have Dr. Scott Marshall joining us for our very first member profile. So welcome, Scott. Thanks for taking time today to speak to us.
You're welcome, Jeff, and thank you for inviting me.
Can you tell us a little bit about your practice, how long you've been in practice, where you practice, the type of practice that you have?
Sure. My practice career started briefly in Barrie after graduating University of Waterloo in '94, and then my wife, Dr. Linda Bishop, and I set up a practice in Parry Sound, Ontario, and we've been here ever since, 19 years. We have a 2.5 doctor practice with full scope care, and have enjoyed building our practice from that point onward.
Great. Now, thanks for that intro. And part of the reason I reached out to you was I learned that you guys have an interesting relationship with the Northern Ontario School of Medicine, where you have interns coming through your practice. So can you tell us about how that relationship started?
Sure. It was probably about 4 to 5 years ago. We were approached by the Medical Society here in Parry Sound. They were preparing to host students from the new Northern Ontario School of Medicine, which is based in Sudbury and Thunder Bay. And these third-year students were being invited to tour around and visit other medical professionals to get a sense of how a community-based health network would work. And so we were more than happy to be invited to host these students or proctor these students as they're learning through their 4-year program.
So can you maybe give us some more details around that? Like how many of these students come through your practice in a given year? How many days or half days do they spend in your practice?
Sure. So it started off that, and it's continued basically from the point, the beginning onward, that we will have approximately 1 student a week. That would be up to 6 to 8 students per term. And what these students do, these third-year medical students do, is they observe and somewhat assist with our eye examinations and learn all the number of different diagnostic tests that we can perform, as well as we allow them to practice some slit lamps, some ophthalmoscopy, but get a general sense of the importance of the eye exam with the general health of the patient, and also a lot of the ocular complications that can arise.
What are some of the I guess the no pun intended, but some of the big sort of eye-opening things that these students go through? What's their understanding of optometry when they first walk through your door, and what's their understanding when they're done their experience?
Great question. Unfortunately, these third-year students don't really have a lot of diagnostic test experience. Some of them have barely learned how to turn on a slit lamp, let alone use a slit lamp. And ophthalmoscopy is certainly also something that they get very, very little experience with. And we discovered that these students are planning on working in emergency rooms or in family medicine, and they really need to bone up on some of those skills. But some of the things that they get to experience is certainly how we approach diabetic patients, how we approach patients with multiple factors in their ocular health, and just like everyone else, we have quite a variety of pathology that we run across every day, and they get some hands-on with that, which they really appreciate.
So do you think at the end of the day they walk out of your practice and they have a better understanding of what we do, and then maybe potentially once they start their own practice, hopefully refer to our colleagues. Do you see that as part of as some of the benefit to having them through?
I think virtually every student that comes through has that same take-home message, that they understand that optometrists are more than just dealing with eyewear, that we play a big part in a community health network, and certainly our rapport with the emergency department and the family doctors has improved because these students have that message not driven home, but they basically understand it pretty quickly that we play a big part in that. So that's what they usually take home. Plus, they also feel a little sheepish because they don't really have a lot of clinical skill when it comes to the eye.
So obviously, it sounds like the students get quite a bit out of it, but obviously this is a big commitment for you to have these students through your practice. But what's your big takeaway? What do you get the most satisfaction from?
I think the greatest satisfaction is just the respect that we're given. We hear, unfortunately, through specialists or the OMA that optometry may or may not be given the same respect when it comes to clinical care, but these students certainly have that trust and respect that if they want us to be a part of their patient care, that we can certainly pull our weight, and I think that's the greatest benefit we receive. It does interfere, obviously, with a normal day of patients, but it's well worth it.
Well, I would like to thank you, I guess, on behalf of the entire membership, because a lot of these students, when they graduate, they're going to practice at various places across Ontario. And thanks to you and your practice, you've opened their eyes as to what an optometrist does. And I think changing referral patterns is a generational thing. It takes a lot of time to do that. So we really appreciate you taking the time to help educate these, and hopefully we can replicate this model across more medical schools, which are primarily in Southern Ontario.
To be honest, I'm kind of shocked or surprised that there aren't other medical schools that offer some form of internship like this. Maybe it's something that someone at the Northern Ontario School has really put an emphasis on, but I totally agree with you that I would be hopeful that a lot of the Southern Ontario schools would be able to adopt the same thing.
Thanks, Scott. Thank you so much for taking time from your busy day seeing patients and being our first member spotlight for the OAO. So thanks again.
Jeff, thank you very much for the opportunity, and I hope it's a big help.